Hi, I'm Michelle Zube. I'm a Board Certified Behavior Analyst with Brett DiNovi Associates. Today I'm going to be talking about teaching empathy to individuals with autism, and this focuses on the current task list items D-02, 3, 4, and 13, E-02, and J-11. One of the hallmarks of autism is deficits in social skills and prosocial behaviors. While many social skills can be taught and programmed for, empathy and perspective taking pose significant challenges for learners and teachers alike. One of the variables contributing to this is that individuals with autism are less likely to observe and label emotions of others, and therefore lack the ability to take their perspective and respond empathetically. Perspective taking and empathy are essential components to developing social relationships. It is suggested that those who engage in these behaviors are more likely to have others initiate social interactions with them. Previous research has sought to find appropriate interventions for teaching these skills using modeling, prompting, and reinforcement. Harris, Handleman, and Alessandri in 1990, and Reeve, Towson, and Paulson in 2007 viewed these deficits as a stimulus control problem and addressed the issue by presenting multiple discriminative stimuli. Schrant and colleagues 2009 also viewed these deficits as a problem with stimulus control. Stimulus over-selectivity, or responding to a limited number of cues when presented with complex stimuli, is often the stimulus control culprit at work. When new discriminations are being taught, learners may attend to only a few or irrelevant stimuli in the environment. Schrant and colleagues suggest that failures in empathy may not be a deficit of response and repertoire, but rather an inability to differentiate the stimuli in the presence of which specific responses, such as offering help, would be appropriate. The purpose of their study was to assess the extent to which a treatment package consisting of the presentation of effective discriminative stimuli compounds, prompt delay, modeling through auditory scripts, manual prompts, behavioral rehearsal, and reinforcement was effective in teaching empathy skills in pretend play settings to children with autism. Behavioral rehearsals and prompt delay were used to prevent and correct errors, which were judged to be a potential difficulty. Additionally, they assessed generalization of empathy skills from training to untrained probe stimuli and from training dolls and puppets to actual people in an untrained setting. Effective discriminative stimulus compounds contained one motor and one vocal component, which were presented in brief vignettes where an instructor held up a doll or puppet and pretended to make it say a statement paired with an action. Vignettes fell into three categories: sadness or pain, happiness or excitement, and frustration. For example, in the sadness or pain category, a vignette consisted of the instructor holding a puppet, having it bump into a table, and saying ouch, as if the puppet had hurt its leg. To promote generalization from training to untrained stimuli, dolls and puppets were not assigned to specific vignettes. Empathy was operationally defined as a contextually appropriate response to a display of affect by a doll, puppet, or person that contained motor and vocal components and began within 3 seconds of the end of the display. For the example of the puppet bumping its leg, the participant could be taught to say, "Are you okay?" and to pat the puppet's arm. The treatment package was delivered across training sessions, which consisted of 30 trials where manual and auditory prompts were delivered according to a prompt delay sequence. A behavioral rehearsal sequence, which consisted of the prompter manually prompting a correct motor response and simultaneously playing an auditory script, was used for all training sessions in the 0-second delay condition and for errors of omission and commission in all other prompt delay conditions. Generalization trials for the untrained probe stimuli were randomly interspersed throughout all training sessions and consisted of vignettes similar to those used during training trials. Novel dolls, puppets, and toys were incorporated. Generalization to novel people and settings occurred approximately 1 week during baseline and training, and an actual person replaced the dolls and puppets and presented the training vignettes used in the training setting. Sessions were conducted in a room not associated with training. The results of this study indicate that empathetic responding to sadness or pain increased systematically with the introduction of treatment across all participants. Thus, it can be concluded that the intervention was successful for this group of learners. This intervention facilitated generalized empathetic responding from trained to untrained probe stimuli and to actual people in the untrained setting for 2 participants. The results of this study are important because they support that children with autism can learn to demonstrate empathy skills in pretend play settings, which can then be generalized to pretend play vignettes, toys, and to interactions with real people in untrained settings, although generalization from pretend play to real life may be limited. The authors note that dolls and puppets were used for this study because typical peers and other people were not readily available for teaching in this setting. However, teaching with actual people would likely be a more effective strategy to promote generalization from pretend play to real life. Their hypothesis regarding stimulus control was supported by the types of responses participants gave during baseline, when the responses given were contextually inappropriate for the vignette category, but appropriate for another. If we shift our focus to stimulus over-selectivity, we may increase our skill acquisition in this area. The use of multiple exemplar training and teaching using complex stimulus compounds for each response category may have promoted generalization and should be also taken into consideration for programming. Children with autism face challenges with social skills, particularly those that require a more complex behavior such as perspective taking and empathy. By teaching these skills, individuals with autism may increase pro-social behaviors, which in turn increase the likelihood of more meaningful interactions with others. Thank you for watching. Please help us disseminate the science by sharing with a colleague, subscribing, and commenting below.